The governor and state surgeon general are vowing to get rid of all vaccine mandates in Florida. Everything from mumps and measles to chickenpox and hepatitis B. Now, all the vaccines that school kids currently get will still be available, but they will not be required any longer.
And as Fox 13's Evan Axelbank reports for us, it is a policy change that is raising concerns in the medical community.
The governor is framing this as a right of a parent to make choices for their child. Public health experts say the proof is overwhelming that vaccines work. The Surgeon General described vaccine mandates in the starkest of terms.
Every last one of them is wrong and drips with disdain and slavery.
He and the governor are pushing for Florida to become the first state in the country to repeal vaccine mandates, including ones that insist that children in any Florida school, public or private, from pre-K to 12th grade, be vaccinated against once deadly diseases like measles, tetanus, and polio.
What you put into your body is because of your relationship with your body and your God. I don't have that right. Government does not have that right.
It would require the legislature to change at least 4 Florida laws. But some of the newer mandates, like for hepatitis and chickenpox, are only rules issued by the Department of Health and can easily be reversed by Latipo himself.
He's not going to necessarily receive a warm embrace by some of the people in his profession, but that's really what courage is all about.
Public health experts are pointing to charts like these: measles, mumps, rubella, polio, tetanus. They all went down when vaccines became widespread. They're concerned that if vaccine rates continue to dip, which in Florida are now a relatively low 95%, that diseases that were all but eradicated will not only begin to spread, but begin to evade vaccines we do have.
If we have too much spread of the virus, they'll adapt. And eventually the vaccines will have to be reformulated or use a newer strain of the virus for these live attenuated viruses like measles, mumps, and rubella in order to provide coverage.
USF immunologist Dr. Michael Tang points out that an area of Texas that had relatively low measles vaccine coverage saw an outbreak of nearly 800 cases, while an area of Rockland County, New York in 2019 saw more than 300 cases. He argues the vaccines that have been in circulation for decades are sensible, as opposed to being a type of slavery, in the word Surgeon General Latipo uses.
Most of the doctors that are born today were born after those were common in the United States. So this is a really different type of escalation in anti-vaccine rhetoric.
The governor also says that doctors should be banned from requiring their patients to be vaccinated before they treat them. The governor is forming a commission that would study how to adapt federal Make America Healthy Again theories, a part of the Florida state law. Immunologists say the most vulnerable population to diseases like measles, mumps, and rubella are children. Evan Axelbank, Fox 13 News.
Well, vaccines will still be available and pediatricians will still recommend them. But the announcement upends decades of vaccine policy in Florida that required vaccines for school-aged children. Reacting to the announcement, the Florida chapter of the American Academy of Pediatrics released a statement saying in part, quote, "We are concerned that today's announcement will put children in Florida public schools at higher risk for getting sick, which will have a ripple effect across our communities."